Do you know anybody that needs to lower their heart rate and help their blood circulation? Well, if you do you want to listen in today, because we have with us today Nick Swartz from the Stretch Zone. He is applied physiology specialist and kinesiology, and he's also a pre-med student at UF. So we want to welcome you here today, Nick. How are you?
Thank you. I'm doing well. Thank you very much for having me on today.
Great. Well, I know we want to learn a lot from you to help teach our people listening ways that they can improve their body naturally. Okay. So let me ask you a couple questions. Well, first of all, I looked up a little research, and I looked up Harvard, and they said that it's not enough to just build your muscles and do aerobics. Do you hear feedback?
Yeah, I think that's totally, those are two important aspects of fitness, but one of the most overlooked aspects of fitness, which I think becomes a lot more important with longevity and with the aging population, is range of motion and flexibility, which is kind of what I've been more focused on recently here at Stretch Zone, and what a lot of people have been recognizing is really important to work on as well, besides just, muscular strength and endurance and cardiovascular health, which are usually the main focus when it comes to fitness.
Okay, great. Well, okay, great. I'm getting feedback. That's why I keep stuttering like this. So let me ask you a couple questions here. They talk a lot on the internet about how important it is to lengthen our muscles. Can you talk about that a little bit?
Yeah, it's really important. So one thing that was kind of cool when I started to do more research about stretching is that stretching is actually 100% neurological. And so what that means is that our muscles have a full range of motion that they can go to, and then they have a full range of contraction. And it's pretty much, the proportion is pretty much similar for everyone. And really what limits each person's individual level of flexibility is actually their sensitivity to something called the stretch reflex, which is like if you've ever gone to the doctor's office and they take that little hammer and tap on your knee to see if you have a good reflex. That's the same reflex. It's called the stretch reflex. And basically what it is, it's a signal in your body when your muscle feels a little pull on it for your body to naturally respond and to contract in order to protect the muscle from tearing. And so what happens is, as we go through life, that stretch reflex becomes sensitive. Either we, have like a little accident or a quick movement, or we have like a continuous movement, like a lot of people sit a lot and they do it every day. And so that movement is kind of more natural for them. And so the stretch reflex gets sensitized to that movement. And then if there's anything outside of it, the body says, hold on, slow down, don't go any farther, or else you're going to hurt yourself. And so what happens is the body gets locked up and flexibility gets limited. And so a lot of the training that we do here for people to work on their flexibility is working with their breath and movements, which is the best way that I've seen to kind of help desensitize the stretch reflex and get the body back to its natural range of motion.
Wow. So that's really important to be able to sort of train your brain. Is that what it is? Are you training your brain to stretch better?
Basically, yes. The majority of flexibility, I would say, is all neurological. There's some, depending on some people's natural like anatomy and body structure, there can be some people that are a little less limited than others. But for the most part, it's basically all the nervous system that's playing the role in flexibility.
Well, I want to be a little bit of a testimonial for you, because I had, and I still do a little bit, as you know, have problems with my IT band being too tight. And I came to you twice now, just everybody listening should know this, twice. And he stretched me. I didn't do hardly any work at all. Isn't that lovely? And Nick stretched me in ways I've never been stretched before. And even though I've had this IT band problem for a couple of years, it just, feels tight. When I walk on it once in a while, I'll even limp. It hurts so bad. And it's helped 70%. I've been to the chiropractor, doctor, massages over the 2 years, but what Nick did in 2 visits helped immensely, 70%. So thank you very much. And it's just like a miracle almost.
Yeah, of course, my pleasure.
Thank you. So, okay, here's another question. I read that if you stretch properly, and I understand some stretching you should not do at home. You should have a professional like yourself stretch. What do you think about that, first of all?
Well, definitely. So, kind of like a general rule of thumb, what I tell people always is that a lot of people ask the question, when should I stretch? How should I stretch? Should I stretch before I exercise or afterwards? What's going to give me the best bang for my buck? And my general rule of thumb that I tell people is to do dynamic stretching before a workout and then static stretching after a workout. And
So explain the both of those.
yeah, of course. And so our dynamic stretching is like, maybe for those of you that played some kind of like high school sport or something like that, is like the high knees and the butt kicks and jumping jacks and kind of those movements that you're lengthening the muscles, but you're not just sitting there and holding them. They're taking your body through a range of motion, and it's probably a deeper range of motion than normal, but it's moving while doing it. So like the two biggest examples that I see people is like the high knees and the butt kicks. People that played like soccer or football or usually any kind of sport do that kind of dynamic stretching. So that's the best stretching to do before a workout. And then after a workout, that's the better time to do like sitting down and reaching for your toes, or all of those, standing up and hanging over, the cross arm stretch, all of these classic stretches that you can do to yourself where you're holding them for a little bit of time. Those are better to do after your workout because your body's already going to be nice and loose, and you never want to stretch a cold muscle.
Now, is there a third type of stretching?
Yeah, so there's this another kind of stretching, which is called PNF stretching, which is basically like when a person is, it's a form of assisted stretching. So you need someone else to help stretch you. And what you do is for example, if I'm laying on my back and holding my leg up, someone is going to be kind of holding my leg for me, and I'm going to be trying to push my leg down, and they're going to resist me. So I'm offering some resistance, and then they're going to hold, and then all of a sudden I'm going to let go. I'm going to stop trying to put my leg down, and then they're going to push my leg through the range of motion. So basically what it is, it's like resisting a stretch and then giving into it. And then it kind of tricks the muscle to go farther into the stretch. And it's a really great way to stretch. It's a really effective form of stretching. However, we don't do that kind of stretching here at Stretch Zone because we're kind of attending to more of the general population. And for people that aren't very familiar with stretching, kind of just static and passive stretching, it is a higher risk for injury since you're offering some resistance and then, kind of pushing as hard as you can with maximum force and then letting go. So that stretching is better for people that are a little bit more athletic, usually like professional athletes and people playing sports and stuff, already after they've worked out and already after they've done some kind of passive stretching, because you never want to overstretch someone.
That's interesting too. That's great. Thank you. So they say that stretching can help deliver your nutrients to your muscles. It increases your blood flow and boosts your oxygen levels. Is all that true?
Yes, of course. Any kind of movement where you're using the muscle is going to help bring oxygen to it, help create dilation of the blood vessels, and then therefore in sequence the delivering of nutrients to the muscle as well too.
That sounds like a good thing to get our bodies working in a more efficient manner. So it also says that if you don't stretch, that's the number one cause of pain in a body, is by not stretching enough, then your muscles cause pain. What
Yes.
about that?
Well, kind of like a good analogy that I like to give to people is if they look at little kids have great range of motion in their body usually, unless they have some kind of neurological disorder. Most kids have great range of motion in their body. When they sit down and play, they sit in a squat to play with stuff. They have great range of motion because kids are moving much more than we are, and kids do more functional movements. They squat down to pick up stuff. They reach. They're more playful. And what happens is, as we grow up, we tend to stop doing those kinds of movements, and then we tend to kind of get locked into a rhythm where most of the movement that we do, unless we're like focusing on being athletic and being flexible, is we're sitting way too much. We're not, extending our body as much as we should, and we kind of lock ourselves. Most people, they have like their shoulders rolled forward from like being on technology a lot, and then their pelvis tilted forward from sitting too much. It's like very common imbalances. And so when you kind of get into a repetitive movement, your muscles start to lock up into that position. And then that's not how our body was designed to be. That's just kind of the laziness of human beings, wanting to sit down in chairs and not sit in a squat. Actually, in a lot of Asian cultures and Eastern cultures, a lot of people, they sit in a squat or sit on their knees a lot or eat on the floor, and it's better for the body than sitting in a chair. I always tell my clients that sitting is the new smoking for your body, and so lack of movement is going to cause that stretch reflex, like I talked about earlier, to become sensitized to the normal pattern of the person. And so you got to use it. If you don't use it, you lose it. And then if you try to use it after you've lost it, it's going to hurt. And then you have to take some time, do some stretching to get back to the baseline.
So when I came, you suggested that we come once or twice a week. We also should then exercise and stretch the days that we're not there as well, I'm assuming. Yes.
Yes.
And how
for
many
sure.
times a week should you stretch, or should it just be every time you exercise?
So I think that for me personally, I can speak for myself. I stretch every day. I try to wake up in the morning and do some stretching, and then before I go to bed, do some stretching, and then either during or after some physical activity, I like to do stretching as well. A lot of the activity that I do is pretty like functional movements, like yoga and martial arts and stuff like that. So I'm moving my body kind of in some stretchy ways during my exercise, which I think is a great way to do. I highly recommend yoga and martial arts as well too, for the people that are into that. I think they're great ways to move the body. But doing the kind of stretching that we do here at Stretch Zone, definitely I would kind of cap it at 3 times a week. I think 3 times a week, anything more than that would be a little bit excessive, because as you noticed when we were going through the stretches, the stretching is pretty intense and you don't want to overdo it. And so it kind of depending on where the person is in their range of motion, and then depending on also how frequently they're able to come in to get stretched, we recommend anywhere between 1 to 3 times a week.
Now, I do want to add that you all stretch us. You're stretching us, as I mentioned, in ways we've never been stretched. But I would never attempt to stretch myself or even ask a friend to stretch me in the ways that you stretch me, because I'm afraid I would hurt myself. I don't know what's the proper directions to do it. That's very important, don't you think, to not have people be stretching themselves every which way but loose at home?
Yeah, don't I wouldn't attempt to try and stretch people, even if I have a friend that he says like the internet is the worst place to learn stuff. And so we went through like some people, they go and they try and watch YouTube videos about stuff, but all of our stretchers here, they they all had a background, half a background in anatomy and physiology, and then they all went through a certified course that's, a nationally certified course I'm not quite sure of the abbreviation, but it's basically the National Board Association for Body Work. So it's the same kind of board certification that licensed massage therapists have to go through as well too. And so all of our stretchers are very well equipped, and Stretch Zone has a very good program, a training program, and it's not kind of like an easy program. The when I went through the training, and myself and the general manager of our store, there were about 14, 15 of us that started, and only about 7 that were able to graduate, because it is pretty rigorous. It's not just any old person that's able to pass the course.
And I just want to mention, because our group is non-selling, so we know there's probably other stretch places in America. Anybody that wants to go get stretching, go ahead. We're just introducing you to Nick because I know he's great, and he's going to actually offer us a program. If you want to try it, he'll offer you a free one at the end, but it's nothing to do with selling. We're educating you. So,
Yeah,
right?
Yeah.
Okay, so backing up just one more second. Sometimes I've gotten massages and the girl will bounce me when she stretches, but I understand that's a no-no. Should it be slow and smooth or bouncing?
Well, it really depends. There is a kind of stretching that does involve more bouncing movements. That's called ballistic stretching is the word for it. And that is a form, depending, because the idea is to trick the stretch reflex. And one way to trick the stretch reflex is through bouncing. And so sometimes, like during our warm up and stuff, I'll do some bouncing motions depending on how I'm feeling the person is responding. But it really all depends. I treat each person as an individual. We don't have like a general routine that we just do for everyone. I really do like I did for yourself. I did an evaluation with you, and then kind of pick the personalized stretches that I wanted to do for you based on kind of how I felt your biomechanics are and how your body was moving. And so that is one way that you can do. I mean, I wouldn't recommend, sometimes someone might want to start like bouncing in a stretch themselves, and then they take it a little too far. I never, in Stretch Zone, like you were made aware, we use a scale from 1 to 10 to communicate the intensity of the stretches. And we never go past a 7. So a 7 would be like a nice deep stretch, but still, not feeling any kind of discomfort at all. We never take someone past their level of comfortability. One, because there's no necessity. You can still develop a lot of flexibility without, grinding your teeth together and having a bite on something. And then also, we don't want to hurt anyone too. So if people can bounce into a stretch, I'm not going to tell people what they can and can't do, but definitely don't take it too far.
I didn't research this, but I was wondering if since stretching lowers your blood pressure, increases your oxygen level, and it helps deliver your nutrients to your muscles, does it also help in life's longevity? Does it allow us has there been studies that show that it helps us live longer?
Yeah, so I don't have anything that I can reference right now. I have read some stuff previously. I don't want to say something and be wrong, but yeah, I have read things that talk about, if you compare range of motion is a good indication of longevity markers, as well as muscle mass. Muscle mass is a good indicator of longevity as well too. It's correlated with longevity. So people that are able to build lots of muscle, I definitely recommend that to people too. Because it is correlated with old age as well as range of motion too. And so I don't have any studies in front of me right now. Maybe I can look up before our next session, get those ahead of me that talk about it. But I'm pretty sure they've done some studies that correlates. I personally haven't seen anything that has showed causation, which is like there's 2 types of studies of data that can be compared to each other. It's either correlated, meaning both things exist together, and then causation, which shows that one thing is causing another. I don't know if I personally haven't read any causation research about range of motion and longevity, but I can do some digging.
Okay, great. Because ladies and gentlemen, we are having another uh, interview with Nicholas next week. And if you don't mind digging up some other material, other topics that we haven't discussed, or maybe go into a little more meats and potatoes about different subjects on how it works exactly. I would imagine when I'm looking at everything that we just talked about, to me, I mean, I don't have high blood pressure, but I know tons of people who do. So there must be a lot of people out there listening and going to be listening to our interview that have high blood pressure. If you want to reduce your high blood pressure, aside from going to your doctor, this I think would be a great step. Boosting your oxygen level, that'll give you better energy. And then the last thing we didn't really talk about, or maybe let's talk about it next time even, is does stretching help with your anxiety and emotional issues? So if it does it,
I think so too. Yeah, I think and vice versa as well too. I think that the more that we attend to um, any kind of anxiety or depression that someone's subject to have, it will also help with their flexibility. And then the more that a person works on their flexibility, the more it will help with those kind of mental things as well too.
Okay, so maybe for the next interview, you could look up some credible references for that.
Yeah, absolutely.
Okay, great. Because to me, stretching, because you're actually doing the stretching for us, is a sort of a form of yoga.
It definitely. So like a lot of times I like to practice yoga myself. And so yoga sometimes gets misconstrued that it's like having to do all these funny poses and stuff like that. And that is a part of yoga. But the essence of yoga is breath work, just taking deep breaths and connecting to the breath and being present. And that's one of the things that we really focus on when we're stretching people, is making sure they're breathing nice and deep, that they're connected to their breath, that they're developing the mind muscle connection. So in that sense, yes, it is like yoga, because the breath work is one of the most essential parts of the stretch.
Okay, great. So unless you have something more to say now, you're going to do that homework for the next meeting.
Yep.
Okay.
Yeah, for sure.
And I know you'd mentioned to me that anybody in Gainesville area, you can't speak, we know that whoever you work for is nationwide, but everyone offers different specials. But
Yeah.
anybody in your area, go ahead.
Yeah. So I don't know for a fact because all the Stretch Zone franchises are independent. And I don't know if all of the rates are the same or anything like that. I know at just about every Stretch Zone that I've come into contact with, that the first session is free, and so you can contact them. So that should be the case for all of them. You can go and do a first-time demonstration. That's kind of what was indicated us when we were trained at our corporate office. That's how it works. Come in for a free stretch, see how you like it, and then we can discuss what kind of programs would work for you. And so you can come in the Gainesville area. If there's anyone from Gainesville watching, we're in the Royal Oak Plaza next to the movie theater on Newberry Road, close to Newberry Road and 34th. And actually, as of December, we were looking through the reports. Stretch Zone kind of has a program that allows us to see how we compare to other stretch zones. And Stretch Zone Gainesville got the #1 spot for all of the stretch zones in the country. So if you're in the Gainesville area, you're coming to the best one. Yeah, exactly.
Okay, so it's right up the road from the University of Florida, right next to Ballyhoo Restaurant.
Yep.
Right. So just so everybody that's listening that goes, they don't pressure you. In fact, when I went in, I said, I'm going to get my free stretch. It's probably just going to be a stretch and I'm leaving. But I was so impressed, I went ahead and did get the once a week to try that out. So they don't pressure you though. Nick was not pressure. He's a professional. He's a pre-doctorate, med school. So he's not a salesman. He's just going to show you evaluate you, show you what's going to be done. And he does it for about 35 minutes. He'll actually go ahead and stretch you. And then you say yes or no. It's no big deal. So for anybody that would like to, make sure you ask for Nicholas Swartz. Do you want them to just call the office or text you?
Yeah, no, it's better for them to go ahead and call the office. And so
What
our
is that
number,
phone number? Well, it's just in Gainesville Stretch Zone.
yeah, and I can say it here just for people to hear. It's 352-451-4107. And I can text you that number as well, and you can post it as well too.
Okay.
And they can come in. And so it's usually the first session that they do, the first stretch session will be either with myself or our general manager, who's his name is Marcus, and he is wonderful as well too, and will give you the same kind of experience that I will as well. And so no matter who you come to see, you're going to be in good hands.
Well, we appreciate it, and we will see you next week.
Wonderful. Yeah. Looking forward to it.
Okay, and then and what are you going to do on the next one? You're going to talk about more, maybe some mental, so how to alleviate, or does this alleviate mental stress and anxieties and depression? You're going to do a little more research on that? Okay.
Yeah, and maybe I can,
Okay.
there's this book that I read, or that I've, I haven't read it fully, but I've gotten some pieces from it. That's a good book. And if everyone would like to look it up, it's called The Body Keeps Score. And it's all about kind of like the physiological consequences of our mental state and vice versa. And so maybe I can, refresh myself on some of that information, and then look up some more stuff about longevity and stretching, and then present some information to you guys. And just so you guys know that this is I work here at Stretch Zone, and I'm happy that Trish invited me to come and to speak about it. I'm not speaking on behalf of Stretch Zone at all. I'm speaking from my individual place as me. I really believe in Stretch Zone as an individual, and I think it's really beneficial to anyone. But I'm happy to just talk about stretching in general, and physiological benefits of exercise and stuff like that. But I'm definitely not putting myself in the place as a representative of Stretch Zone. I'm just speaking from myself.
Right. And then we also want to say that we're not, we want to make sure everybody knows they need to go see a doctor first. We don't want to act as their doctor. We don't want them to get hurt. We want to have a disclaimer here.
Yeah. And Stretch Zone we're not a clinical modality. There's nothing clinical about us. We're a fitness modality. And so if you want to come, you don't have to have a doctor's note. But if you want to come, but maybe you're iffy about whether you should come based on something that you're dealing with, maybe that you're in physical therapy for, something like that, definitely consult your physical therapist or your doctor beforehand. But if you don't feel like you have anything wrong with you that might be pertinent to stretching, come on in. You don't need a doctor's note. We're just a fitness modality. So it's kind of like personal training for flexibility.
It's like scheduling for a yoga class. The difference is in yoga, you're doing the work. This one, trust me, ladies and gentlemen, you lay there, they do everything pretty much. They'll say roll over or roll on your side, but they pretty much do every single thing. And which sense is why Nicholas has the most unbelievable muscles from lifting all those people and rolling over.
I wouldn't go that far, but
I'm sure your fiance would. Okay, so we'll see you next week. Have a great week.
Yes, ma'am. Thank you very much.
Thanks for coming.
All right.
Bye-bye.
Bye-bye.